like a class, like we're back in school again, okay? Anybody needs to go to the restroom, just raise your hand. We'll go out the door. My name is Rod Goldberg. I'm the Senior Benefit Administrator for Beskin and Associates. And standing to my right is our Compliance Specialist, Corbin Granger. And we're glad to have everybody either attending or online with us right now. We're going to occupy your time for about an hour, hour and 15 minutes and address what we call when the rubber meets the road, because we're down basically to almost 45 days to when the exchanges are supposed to take effect, and basically 3 months, January 1st, until 4 months, excuse me, until the law actually goes into effect. Between the news, the newspapers, and scuttlebutt, there's a lot of information that is correct, and there's a lot of information that is incorrect. And we're going to take these next hour, hour and a half to clarify what is fact and what is myth. With that, I am going to turn it over to Corbin. Go ahead, just switch. And I just do, for those that are online, I want to take a second and thank our computer techs, Matt from IC Macro Company, that's done all our computer work for the last 15 years and has been quite instrumental in putting this entire presentation together. For anybody that has any computer issues, Matt can be reached through our company if necessary, or on the slide that is in the presentation. Without further ado, Corbin, I'll turn it over to you.
All right. Good morning, everyone.
Good morning.
Good morning. Just if anybody's listening on the webinar, if they'd like to type in a question at the end, we'll have Rod Goldberg address those questions. As he intimated, we're calling this where the rubber meets the road because we have moved from the hypothetical world to the real world implementation. And so we wanted to discuss today how underwriting is going to look in 2014. What is this marketplace? How could someone qualify for a subsidy? And what does it mean to you, whether you're a small employer or a large employer? Because there are different strategies based upon the size of your group. So with that, I want to go into the slide, and this is Matt's company again. It's icmicro.com. So if anyone ever has any questions, please call Matt Wendt. He's been extremely helpful this morning in setting this up. So with that, I want to talk about how reform is going to change the landscape. What is our 2014 world going to look like? And we've made some estimates, and large business, for a number of different reasons, one of which, of course, is the delay of the employer mandate. We're not going to see probably a big shift on that front. Small business is probably where you're going to see the greatest shift for a number of reasons. One is the market rules that go into play and the age rating rules, and the fact that since there are no penalties at that level and you as an employer can allow some of your low-income employees to access the exchange and the subsidies, you may choose to actually do what we call either an early renewal to delay some of the costs, maybe even consider disbanding coverage. And so the individual market is going to see an incredible increase. Medicare is listed on there, but that's really just simply a fact of that is a standard issue with respect to the baby boomers retiring. So underwriting in 2014 on and off the marketplace, we're going to talk first about the individual and small group market. I'd like to point out that in the marketplace and outside the marketplace, the premiums have to be the same. So the real attraction for the marketplace for an individual is that bucket of government money, is that subsidy that's available. And so we're going to talk after we go over the underwriting into how someone could access that. So today you've got Peter and Paul. Peter is healthy. Paul isn't as healthy, so Peter enjoys a better rate. condition-based rating goes away in 2014, so Peter and Paul are going to be level, with the exception of if Peter smoked. In the individual and small group market, there can be an up to 50% load for tobacco use. Age rating, and this is a very important issue under the law. Right now, people are rated by age, and generally it's what we call a 7-to-1 ratio. So if Peter's rate was $1,000, Paul might pay $7,000. In 2014, it has to go to what we call a 3-to-1 ratio. And what that means actually is Paul is going to come down, but Peter's got to come way, way up in order to make up that difference. So when you read in the news, and in some cases that can be as much as 90%, 100%. So when you read in the news where they're talking about how they need those 2.6 million young, healthy people to get into the system, this is what they're talking about. They're talking about the concern because this is the population who's going to experience the greatest rate increase, even with the consideration of the subsidy, and maybe less.
Age band.
Excuse me?
On an age band, the younger person, 20 to 24.
Yes, 20 to 24 is going to pay a lot more. So in that, with that respect, the government is gambling that all of these young, healthy people purchase insurance, and the insurance carriers know they need those young, healthy people. The marketplace is going to go live October 1. There's going to be a huge marketing campaign. So when I tell you on VH1 and MTV, don't be surprised if you might see Snooki, JWoww, and Mike the Situation sitting around, not necessarily with a Dell computer, but with a Humana coffee cup or some other insurance carrier. You know, you're going to start to see some of that kind of marketing because they need those young, healthy people in the system. If they don't, the fear is that they're just going to attract the sick because there is no pre-existing condition exclusion in 2014.
And then the unemployment and underemployment rate extremely high in that age group?
Yes, the question was, is the unemployment and underemployment rate extremely high in that age group? And yes, there is a little, yes, the unemployment rate is probably higher in that age group, and dependents can stay on their parents' plan up until the age of 26. But as you'll see, in 2014, it's no longer a free ride. They have to actually pay for them. And if your dependent is eligible for coverage, if that child is working somewhere else, they are their tax return under that law, so they will probably be going to the exchange to get the subsidy. So let's talk for a moment what the 2014 world looks like for underwriting. Okay, today in the 2 to 14 market, you have gender rates, and rates are accumulated based on each member's age. Okay, so that's for a very small group. In the 15 to 50 market, you have a composite rate. So what does that mean? In other words, if I have family coverage with 2 kids and Rod has family coverage with 3 kids and we are composite rated, we pay the same rate. In 2014, in the individual and small group market, our rates are actually going to differ because Rod would pay a rate based on his age, his wife's age, and each child, each of those 3 children have a rate. Same thing with me. My rate would be based on my age, my spouse's rate, and my 2 children. So everyone in the group ostensibly could have a different rate, which is very different than it is today. Health conditions are factored in. They are not factored in 2014. The only exception is you can rate for tobacco. You can put a load on that. It is not eligible for the subsidy, and in some states they are very concerned because so many low-income people who could qualify for the subsidy also smoke. You may have read that some states are considering excluding that rating factor. We're going to move to what we call 12 localities for rating. And again, I said the age of each member is going to factor in. Gender, of course, factors in today. It will not in 2014. Every male will actually have maternity coverage as well. So the 7-to-1 age band rating, and again, changes to a 3-to-1. If you are in the large group market, so that's 51 to 99, it stays the same as it is today. You're still rated based on your demographics of your group, the health condition, location, and you still have the composite rates. But for the reason of the age rating and the fact that the young and healthy are going to pay more, if you have a young and healthy small group, you may want to do what's called an early renewal, which I will talk about, and that is something that the carriers rolled out in April, but Beskin and Associates have been actively pursuing since February. So the rating is going to be by family member. We do not have the rates as of this moment for the state of Virginia. There are some states that have posted their exchange rates, but as of this moment I haven't seen them yet for the state of Virginia. But this is how it's going to work. Each person has their own rate. So if you're 21, and let's just say the index rate is hypothetically $4,500, you would pay $4,500. 64, you would pay 3 times the rate, or $13,500. The break-even point is at about 40 years old. You can see 0 to 20, you pay a 0.635 of the index rate, but each child is factored in up to a maximum of 3. And I hope this isn't politically incorrect, but if you are, for instance, the Duggars, I think they have, 19 children? So then anyone over the 3 children doesn't count. They get a bunch for free. Okay, what does the marketplace look like, and how does subsidized coverage impact the individual and the employer? Because this is an important issue. If someone goes to the marketplace, if they qualify for marketplace coverage, in essence, they are their tax returns. We are all used to looking at a world of deductibles and co-pays and what is the rate. But under this law, should you qualify for a subsidy, or should your employee qualify for a subsidy, it is all income driven. So you're going to have some employees that are low income that could do very well with the subsidy, and you're going to have some employees who would receive no benefit at all. The marketplace, the open enrollment, it has to go live October 1. The first effective date for coverage is January 1, 2014, so someone would not want to go and enroll for coverage and then drop their current coverage, because it doesn't go effective until January 1. The first open enrollment is extended for 6 months, but every year thereafter, it's actually going to be tied to the Medicare open enrollment, so it's going to be a crazy busy 6 weeks in this country, because you have to enroll everyone in Medicare and in the marketplace. So the estimates are, and I think this is probably a little low with the delay of the employer mandate, more people are going to qualify for the subsidies. About 20 million plus households will qualify financially for the subsidy. I've highlighted qualified financially because there's another layer to that, which is if they have access to what the government calls affordable minimum value coverage, they cannot receive, they will not be subsidy eligible, nor will their spouse or their children if they offer coverage to them. If someone falls at 250% of the poverty level or lower, they will also qualify for a benefit subsidy. So on the marketplace, every plan is based on, every plan has what we call an actuarial value. So the lowest is what we call a bronze at 60%, then a silver at 70, gold at 80, platinum at 90. The subsidy would be based on the second lowest cost silver plan. And what that means is if we, each of us in this room and listening, had a silver plan, on average, the plan would cover 70% and we would cover 30% on average. It can be any combination of deductibles and copays as long as that underlying value is there. If I'm at 250% of federal poverty or lower, I not only could potentially get a benefit for my premium, but for my benefits. So that silver plan now becomes a platinum plan. My out-of-pocket shifts from 30% to potentially 10%. Okay, so what are we talking about when we're talking about income? And this is included as one of the inserts for you to have. I think it's very, very helpful, the federal poverty level. I would like to also tell you that everything based on the marketplace is on household income, which is something that the employer obviously doesn't know. So when you're looking at the federal poverty level, let's say it's me. If I'm between $11,490 up to $45,960, I can qualify for a subsidy, or up to $94,200 for a family of 4. I can financially qualify. Should I qualify? Then my premium is simply a percentage of my income. So it's not actually tied to the rate of the plan. It's tied more to the income, my income. And I'm going to show you an example. To be subsidy eligible, somebody has to be here lawfully or a U.S. citizen. You can't be eligible for other federal programs because otherwise you're already receiving a subsidy basically from the government through Medicaid, Medicare, TRICARE, or CHIP. You cannot have an offer of affordable coverage through your employer. Now, affordable coverage has a very specific definition. It means that you, the employer, and let's just use me as an example, if you offer me coverage just for myself and my contribution for that self-only premium exceeds 9.5% of my household income, then I may qualify for a subsidy. Dependent coverage is not calculated into the cost of affordability. So the plan ostensibly could be affordable for me based upon the premium that you're charging just to cover me, but not affordable because of the dependent coverage I have. Does anyone have a question on that? Okay. It also has to have an actuarial value of less than 10%, of at least 60%. And your broker will tell you what your actuarial value of your plan is. So let's run through how this works in someone's life. We've got Alice here, and just to make it simple, we're going to start, she works for someone who does not offer health insurance. She's 28, she earns $32,000, so she's immediately eligible for a marketplace subsidy, okay, because she falls within the income range. She actually falls between 200 to 300% of the federal poverty level, and so Alice then pays a contribution she pays about 9% of her income, or $2,800. So that's how it works. Except it's not a static situation in someone's life, so Alice meets Bob Land, and they get married. And Bob also works for someone who does not offer health insurance. So he makes the same income she does, and so combined, they're now at $64,000. Well, the issue now is, even though separately they both qualified for the subsidy, now with their combined income, they're outside the subsidy range. Okay? So now they have to go to the marketplace and pay the unsubsidized cost. And how is that going to work? Well, we go back to the CMS table, and so you can find Alice's age. Now, we're using a hypothetical rate here, but we feel like this is somewhat in the ballpark based on conversations we've had with the carriers. So she's 29, Bob is 33, and so she is going to pay a little over 5, so is he, so they pay the total cost of $10,000, the unsubsidized cost. Yeah, which is a significant increase. Now, they're going to have a baby. Alice also had a hair color change. I don't know if anybody noticed that. But married life is tough. So they are thrilled to have their baby, but they're also thrilled because guess what that now means? Because they now have a dependent, they're lower down on the federal poverty scale, and they are back in subsidy range. So they are now going to pay only they're only going to pay 9.5% of their income for the insurance, or $6,080. So that is almost a $4,000 savings simply by having their baby. So you can see in many cases in this law, it's almost like the more people you have, the less coverage, the less expensive it's going to be. Does anyone have a question? Okay, the question was, who's going to calculate all of this? And It's actually the IRS is in charge of providing or reconciling the tax credits at the end of the year. So one of the things that's interesting under this law, and I think that people probably don't understand, they think, well, they're getting the subsidy. It's an advanced premium tax credit. So if you actually end up with a greater subsidy when you file your taxes in 2014 than you should have gotten, that has to be reconciled and paid back. Bob now gets a job. So let's see, we saw how they qualified financially because neither had access to affordable minimum value coverage. But now they do. And the coverage, of course, the test is just on the premium charged for Bob. It is affordable and minimum value. The premium tiers, the employer pays 50% of the single, so he pays about $2,500 just to cover himself. He would pay $13,000 for the family coverage. He is now required, because of that offer of affordable minimum value coverage, to come off the marketplace where he was enjoying the $6,000 and come on the affordable minimum value plan of the employer. Okay. So what if the employer, I mentioned earlier, because of the market rate changes and things that are going into effect, an employer may decide to disband coverage, or they may look at their employees and say, you know what, we have all these really low income employees and I know some of them could benefit from subsidies, so we want to price it out of their range. How do you help those employees purchase coverage? Because the marketplace is going to be there. There are call centers that exist. There are navigators that are out there to help enroll people in coverage. But we feel pretty strongly that you need to talk to your broker about it. And so you can actually go right to Beskin and Associates and enroll online. So if you wanted to say to your employees, we would like to send you to the marketplace, they can actually do it online. We'll be able to calculate not only on marketplace rate or on exchange products, but off marketplace products. Because the marketplace products, keep in mind, are probably going to be more limited. Some of the carriers have told us only the HMOs are going to be on the marketplace, at least this first year. So the off-marketplace market is going to be much bigger. So I had a client who had has an employee with cancer. Their concern is if they send that employee to the marketplace, would the network be there? What about the formulary? And that's something I think you really need a broker to help you with rather than Sue Johnson at extension 446-8923 at the call center in Vienna, Virginia. But just to give you an idea, there's also a great part of the population now, the younger generation, that prefers the technology approach. I mean, you could always do it in person, but for some of your employees, they're going to want to do it online. And they can just put the information in. It's going to pull up the plans, and it's going to allow them to compare the plans. So Optima, Anthem in this example. It will also, site will be updated to say on marketplace, off marketplace. When they apply, it'll go directly to the carrier website, be able to pull up the subsidy. And so that's how the enrollment process can work. So yes?
Can you explain on marketplace, off marketplace? Does that relate to exchanges?
Yes. The question was, can I explain on marketplace, off marketplace, and how does that relate to exchanges? And, you know, we use the terms sporadically, but exchange and marketplace are the same thing. When the law first came out, it was called exchange. The government said that didn't feel very warm and fuzzy, so they changed it to marketplace. And so that's the term that we use now, but we in the business tend to use that all the time. Sometimes too, you'll hear people refer to the marketplace. Anyone can always go to the marketplace, but really, what is the attraction at the marketplace? It's that subsidy. So that's really all, because the rates have to be the same on and off the marketplace. That really is the attraction for somebody, is that bucket of government money that they might get. let's talk for a minute about how silver and bronze work, because I think this is very interesting. Subsidies are based on the second lowest cost silver plan. And if you think about Medicare, if anybody's familiar with Medicare and the A through J plans, you know, they're not called A through J, they have fancier names. It's the same thing here, but the value is going to be bronze, silver. You can actually apply that subsidy from your silver plan to a bronze plan. And let me show you how that works. So Alice and Bob are going to buy down from silver to bronze. Now, we got this calculation, if you're wondering where the silver plan cost came from, Kaiser Healthcare Reform Subsidy Calculator. You can Google that, and you can actually play with the subsidy if you want to see. So their rate here is about $7,900. They're going to get an $1,800 subsidy, and so their cost is a little over $6,000. They can take that entire $1,800 and apply it to a bronze plan, which is what we call a 40% plan. So now their out-of-pocket increases up to the out-of-pocket max, so their percentage increases, but their cost goes down significantly. And you know, you tend to, I think about this a lot in like someone going to buy furniture. You know, those furniture stores always advertise, you can get furniture low interest, here's your monthly, you know, here's your monthly payment, no interest for 3 years. And so that's what people are thinking. Well, this is my monthly payment. They're not thinking that on the back end there's going to be a 20% interest rate. They're going to look at what that monthly premium rate is going to be and probably not consider as much that you've got that 40% out of pocket, which is fine if you're healthy and you have a good year. But if you need the coverage, then there's greater exposure there. And for that reason, we think that employer-sponsored voluntary plans, you know, these AFLAC plans, Colonial Penn, a lot of different companies are going to be very, very popular because people are going to purchase these very inexpensive plans to cover that gap or that bridge. Does anybody have a question? And we have Tiffany Smith through Beskin and Associates who actually works to set up these programs with our clients. So everyone has to send out the marketplace notice by October 1, 2013. Within the next couple of weeks, if you haven't already received it, you will be receiving another email or fax with the notice. So I just want to spend a couple minutes going over it. I'm going to go through quickly because we got a lot of stuff to go over. But you have to provide it to everyone. There's two, if you offer a health plan or you don't offer a health plan. And what I really wanted to bring your attention to on the first page, it says, if the cost of a plan from your employer that would cover you and not any other members of your family is more than 9.5% of your household income, or the coverage does not meet minimum value, you may be eligible for a tax credit. What that line refers to is if someone wanted to compare or to see if they could receive a tax credit from the marketplace, they would have to take that self-only coverage contribution and compare it to their household income. Okay. Because you only know what? W-2 income, what you pay your employees. It says, who can we contact about health coverage at this job? Okay. We have to use a real name here. Somebody asked me if they could put Homer Simpson in, and I don't think we recommend that. But it's important because people are going to have questions. And so I would put someone down who is a little bit knowledgeable about this so when people have questions, they can come to the right person. Then you get to fill out who's eligible, who's not. As Rod mentioned earlier, in the small group market, see the 30-hour-a-week definition is tied to the employer mandate. And because there is no mandate in the small group market, that means that you still have the flexibility to work with hours. So if you have someone who's working for you 32 hours a week and your eligibility right now is 40 hours a week, you may want to keep it that way because you may be blocking that employee from seeking a marketplace subsidy if you reduced the hour criteria. Okay? And in some cases, you may actually have someone come to you and say, I want to be a 39-hour-a-week employee, or I want to be a 29-hour-a-week employee because I know I could access that marketplace subsidy. Okay. And so it just goes through for some other examples where you check whether it's affordable or not. You're not going to know, obviously, whether it's affordable for the employee. The only thing you can do is put down the premium that you charge for the self-only plan. And that's another area where the rubber meets the road, because employees could go and they're not necessarily always going to know whether the CMS or IRS doesn't really have anything yet to compare the affordability. So it is possible that somebody could get a subsidy that they don't deserve, and it would have to be reconciled at the end of the next year.
Corbin, on
Yes.
the employer notice, because I know we've set our first set out, we're sending another set out next week. On the employer notice, where it puts the name of the employee that they're going to contact concerning questions. If it's a company that really doesn't have a true HR department and they want to utilize, let's say, Terry, for example, are they permitted in that space to put in my name or Terry's name, so when the employee does have a question that's a factual question, instead of being not totally sure by the person they're asking it to, are they permitted to call us?
Yes. Well, the only thing that the marketplace notice is required to say a couple of things by law, which is that the marketplace exists, you may be eligible for a subsidy, and that the employer may not contribute anything towards the cost of this subsidized coverage. So you can edit the form. However, maybe rather than put who can we contact, there's another place on the form that I would probably recommend it. It's down at the bottom of the other page. So, has to go to everybody, new hires within 14 days, got to be free. You are all welcome to write your own notice if you want to take the government on that task. Now, how is it delivered? You can give it out, hand deliver it. You could mail it if you wanted to. You can email it. The only thing I would like to tell you about emailing is the disclosure rules require that it's reasonably calculated to ensure receipt. So what that means is, if I'm working for you and I'm in an office and I use my email for work, you can send it to me via email. But if I'm not really a person who has access to work email all the time, I actually would have to acknowledge in writing that I'm willing to let you send me these documents via email. So, group health. Let's talk for a minute about that. 2014, small group. There is no requirement or penalty for not offering health insurance, and again, the full-time definition is not required to be 30 hours a week. If you offer health coverage, you have to abide by all of the Affordable Care Act rules, and one of them I want to point out is you can't have a waiting period greater than 90 days in 2014 when you renew. Now, health insurance carriers usually put you on the first of the following month, so you're probably going to need to change that to a maximum of 60 days, first of the month following 60 days. But so when you're looking and you have those poverty sheets, when you take them back and you look at them, granted, you do not know the household income of all of your employees, but in some cases you could take, you can take a stab at it, or maybe you do know somebody's situation. And so because you have the flexibility with the hour requirement here, just keep in mind, if you consider offering a part-time employee or somebody under 40 or whatever your eligibility is right now, you could be blocking them from the subsidy on the exchange. And that's kind of a big deal if somebody is, married with children, because in that case, if they're low income, they could probably get a pretty attractive subsidy on the marketplace. Okay. So what are your options for a small group? One is you could just keep everything the same, renew at the normal renewal date. There is a movement out there, it's called the early renewal, which delays the effect for up to 11 months because all of the age rating changes, all those underwriting changes I talked about go into effect when you renew in 2014. The carriers actually came out with this concept in April, but Beskin and Associates was working on this using early renewals actually late January and February. So I'd just like to push that this challenge was an opportunity and they took it, and I think it has worked out well for the clients it has affected. Who might look at an early renewal? A young, healthy group that's going to experience the biggest rate increase under this law would be a good candidate for the early renewal. You could choose to disband coverage and send employees to the marketplace. Now, what's the problem with that? The problem is you're going to have some winners and some losers. We refer to this sometimes as Sophie's Choice. If anybody remembers that movie, who do you save? How do you help everyone? Well, there's something called a simple cafeteria plan that I'm going to talk about in a few minutes that can help you. So let's talk for a minute about the early renewal. For Anthem, for the first quarter 2014, if you're a really small group, you automatically have the option. They are going to pre-select groups with 15 to 50 enrolled. The decision just has to be made by December 1 of 2013, and your Beskin and Associates broker, if they feel you're a good candidate for it, will address it with you. The thing you need to consider, though, is if you early renew, remember you're changing your year to a December 1, so all your deductibles and out-of-pockets reset as of December 1. Okay. Optima's procedure is a little different. They have the time for doing the first quarter in 2014 is actually passed, so it is available if you have a September or October renewal, but in that case you'd have a very short year and the deductibles would reset, but it is available. Okay. So, disbanding coverage. It sounds simple, but it can be complicated. Let's look at Mary. So Mary's 45. She earns $35,000. She's got 3 kids and a husband who earns $40,000. Small employer. Her plan is affordable. To insure her family, it increases to $1,100 a month, so she pays $13,000 for family coverage today. What if the employer disbanded coverage? Mary, she goes straight to the federal poverty chart because she is her tax return. She's now not blocked from a subsidy because she does not have affordable minimum value coverage. So she falls right at between 200 and 300% of federal poverty. So she's going to pay between 8 and 9.5%. And marketplace coverage is a pretty good deal for her, $6,300. Okay? So for Mary, that's good because she falls lower on the poverty scale. But what's the downside? You're going to have someone who is not subsidy eligible, or a number of people who are not subsidy eligible. So let's meet Jim. He earns $150,000. He's got 3 kids. His wife stays at home. For him, the employer-sponsored plan isn't such a bad deal, $13,000. But if the employer cancels the group coverage, he then has to go out to the marketplace and get unsubsidized coverage, which is going to cost him, again, this is a hypothetical because we actually don't have the rates for Virginia yet, but roughly $23,000. And let me show you how we got that. So we go back to the CMS rating chart, and it shows you Jim's age, his spouse's age, and each child pay a percentage of the index rate. So that's how you come up with the total cost. So Jim is a big loser under this law. Does anybody have a question on that? Okay. How do you help everyone? How can you help Jim? How can you help Mary? There's a thing called a simple cafeteria plan. Believe it or not, it is a little gift in the Affordable Care Act because most cafeteria plans, if you're familiar with cafeteria plans, you're setting aside pre-tax money. So like a 401k or something like that, the highly comps and key people can be limited because if the people that want to put the most money in are generally the highly comp and key, and so it fails the discrimination test. This plan, simply by the fact that it's called simple, works in reverse. It's all based upon your percentage of your income or salary redirection, so it actually benefits the highly comp and key the most. Who's eligible? If you have an average of 100 or fewer employees for the past 2 years, you can grow up to 200 employees. You can exclude a number of employees under age 21, less than a year, collective bargaining agreement, non-resident aliens. Ineligible to participate are self-employed partners and shareholders in more than a 2% C corporation. But, you know, there are other ways to address that for those individuals. So if you did choose to disband coverage, I would talk to your Beskin and Associates broker, and they can give you a strategy for the 2% or more shareholders, but you're also able to benefit the people that you're sending to the marketplace. Okay, so let's show you how it works. You got Mary and Jim. Here's their census. So it's all based upon income. There are 3 ways to come up with the contributions. It has to be a uniform percentage, so it can vary from 2 to 6% of income or be twice the employee's salary redirection. You do not have to offer cash. So if you offered me, let's say, $1,400 and I didn't use all of it, then at the end of the year it reverts back to you. Never leaves the checkbook. To keep it simple, you probably should narrow what it can be used for. So you can use it for healthcare expenses or other premiums. Now, Mary qualifies for subsidy. So she couldn't use the pre-tax money in the simple towards the cost of the insurance premium. But what if Mary went from silver to bronze, which we think a lot of people are because the out-of-pocket for the premium is going to be less? She could use this money to pay for her glasses, for deductibles, whatever it is, under that bronze or silver plan. Jim does not qualify for a subsidy. He could use it towards the cost of that unsubsidized premium or that $23,000. So let's give you an example of how it works. We're using 4% of wages. And to give you an idea, so right now, the employer is paying $213 times 7 employees at $17,000. 4% of wages, a little more, about $28,000, but $8,000 of it goes to the owner, so it brings it down to $20,000. And how does that affect Mary? What is her net effect here? Well, Mary, you know, with the employer-sponsored plan, we know that brought her down to $61,612. But you disband coverage. You say, Mary, you can go to the marketplace. Mary goes to the marketplace. It obviously increases her pay because she is subsidy eligible. And then what if you add a simple cafeteria plan? Because you are disbanding coverage, so it is a way to give the employees a benefit. And she would get $1,400, so that increases her, obviously, net household income. What if you just raised her pay? You could do that, but it still doesn't bring her up to where she would be with the pre-tax contribution. Does anybody have a question about that? Okay. Let's look at Jim. So Jim, we know that the employer-sponsored plan was not as much of a stretch. If he goes to the marketplace, he will not get a subsidy, so his income goes down to $126,912. But let's add in the simple. So he gets $6,000, so that brings him back up. Not completely where he was, but it does bring him up. And what if you just increased his pay? Same thing. He would still be below that. Does anybody have a question? I would just like to say for everyone listening to the webinar, I have a lot of very serious faces looking at me right now. Okay. So what's the summary of the simple cafeteria plan? You can use the money to help the employee. You say, I'm out of the game. Now you're out of the benefits game. You're not tied to healthcare inflation anymore. You're just really tied to wage inflation. There are a couple of things that apply to the simple. There's a little fee called the PCORI and the summary benefits and coverage, but that's simple, and Beskin and Associates can help you with that. Let's talk for a minute about the large employer. We know that the employer mandate has been delayed. However, it is our position that you want to use that year that you've been given to be able to be in compliance by 2015. Because one of the biggest problems for a lot of employers is that the fact that that 30-hour-a-week definition of full-time employee is relatively artificial. So we recommend using this year to address anything that you need to with the large employer so that you're ready for 2015. One of the things we don't know is when the penalty comes back. Is it going to come back January 1 or is it going to come back when you renew? So, and the IRS hasn't told us yet. So some of the things you can do as a large employer, you can offer a plan that's affordable and minimum value, and by doing so, no one ever goes to the marketplace. You could keep your eligibility the same for another year, not worry about whether it's affordable or minimum value, and people could be going to the marketplace, no penalty to you. Just keep in mind, in 2015, when you bring back that affordable minimum value plan, they will have to leave the marketplace and come on to your plan. You could offer what's called a skinny plan. We loosely refer to this as a mini-med plan, and this is a really interesting concept. The idea here is you can offer this mini-med plan. It's sort of a bare bones plan. It has some of the market reforms of the Affordable Care Act, like the no-cost preventive, but it's truly a bare bones plan. Why would you want to do that? You can combine it with an affordable minimum value plan, and by doing that, maybe you say to me, hey Corbin, I know even if I offer my employees this affordable minimum value plan, they're not going to take it. You could actually give them that offer of that skinny plan that they may take, and they would have coverage. Why would that be beneficial? Why would you want to do it? Because it would qualify as minimum essential coverage under the law, and they wouldn't be subject to the individual mandate. And you have also met your requirement because you've done what? You've offered them affordable minimum value coverage. Okay? You could do it just by itself, and by doing it just by itself, keep in mind in 2015 the risk you have is that if anyone who goes to the marketplace and gets a subsidy, you would take that $3,000 hit for them if they went to the marketplace. Does anybody have a question about how this works?
You mentioned that in a mini-med plan, there is no major medical. In fact, that if someone has a $100,000 bill, they could be responsible for the whole $100,000.
Okay. As Rod just said, that in a mini-med plan, there really is no major medical. So if someone had a $100,000 medical bill, they could truly be responsible for the full $100,000. All right.
Simple cafeteria plan. You cannot selectively exclude anybody from it. But what about those that by definition are excluded? Where do they go to get their insurance?
Well, you mean the employees under the simple that are like under age 21?
No, I'm talking about the employees under the simple that are 10% have ownership in the company. So I think you said that they would be excluded. So where do they
Correct.
Where do they go to get their insurance?
They could go to the marketplace. They would pay the unsubsidized cost. Now, you as the owner, I guess you could give yourself a raise or give some of those people a raise to cover the cost of the unsubsidized premium, and then the employees that could benefit would get the simple money.
But the only way I could satisfy them would be by giving them a raise, not by giving them the 3 or 4%.
Not through the simple, you couldn't do it. Yeah, it couldn't be the pre-tax money through the simple, correct. But you could work around it. And we have a lot of cafeteria plans today, true cafeteria plans in S corporations where the owners and the partners know, hey, we can't benefit from it, but they see the value of setting that money aside pre-tax. And I can tell you, a lot of times people tend to think that the coverage in the marketplace is going to be first dollar. It's not. I mean, there are going to be deductibles there. It can go as high, you know, it can go relatively high in the marketplace. So they're going to have, in many cases, some significant out-of-pocket expenses subject to that 40% or 30% actuarial value. So Because it's difficult to say to someone, I'm going to disband coverage, and then there you go, even though maybe it is in their best interest because they are a low-income employee and you want them to be able to get that subsidy. I mean, if I worked for you and I'm making $8 an hour and I'm married and I have 2 kids and maybe I'm the biggest breadwinner in the family or my husband doesn't make a lot of money, I would do clearly very, very well in the marketplace, and I would want access to the marketplace.
If you use the 4% hypothetical rate on the first year, can you change that to 2% next year?
Yes. It just has to be a uniform percentage. And so it's my understanding that you could change it each year. It's just between 2 to 6. Right. 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 Yeah, I don't recommend taking a raise away. So. So the skinny plan, the reason this has been used, you might wonder, where did this come up with? Well, there are a lot of restaurants, retail stores. People aren't making huge incomes. In many cases, they're paid minimum wage. It's very hard to structure a plan that meets the affordability definitions under the law. And 2, they know that when they offer it to these employees, a lot of whom are young and healthy, they don't take it. So they're going to look at the dollar amount. So the idea here is to prevent the penalty to the employer, which we know is delayed for 2014, but it'll apply in 2015. So as long as you're offering the affordable minimum value plan, you are not subject to a penalty, and the employees are probably more likely to pick up what we call the skinny plan. And it qualifies for the individual mandate. Because keep in mind, people are going to have insurance coverage or pay $95 or 1% of income. You hear a lot $95, but it really is 1% of income in most cases, okay? It's the greater of, and it goes up each year. So the skinny plan combination, again, it offers a less expensive option for people who don't want the affordable minimum value coverage. And standalone is, this year there is no penalty, but in 2015 you would be taking the risk if someone went to the marketplace to get a subsidy, then it would be that $3,000 penalty. Does anyone have a question? Okay, yes.
Being in an area that has heavy military and frequently one spouse in the military or whatever, are there any situations whereby employees who have opted not to participate in the plan are suddenly going to want to participate because of what's changing out there?
I can't envision a world, especially if someone is eligible for TRICARE coverage. Is that what you're saying? So somebody works for you and their spouse is TRICARE eligible. I couldn't imagine a situation where they wouldn't want to take TRICARE versus come on your plan where you may have to make a contribution for it. Because I personally have TRICARE, and you can access not only military doctors but civilian doctors at a really relatively low cost. Now there is a premium once you're retired and your out-of-pocket goes up, but it really, really is a good deal. I think when you think about this law, you have to say you are your tax return. And so I kind of look at it the other way, in that there's going to be a population of people that are probably going to say, you know what, I don't want to work for you 40 hours. I want access to that subsidy because I'm a single mom and I got 3 kids and I need, your plan is technically affordable to me, but I can't really afford the cost of dependent coverage. So reduce my hours so I can go to the marketplace and get my plan for 2, 4, 6% of income. I think you're going to see, you see that. And especially, as I said, when you're looking at this, of course, you do not know your employee's household income, but in some cases, you can know their situation. And so if someone is the breadwinner for the family, you can look very quickly on that poverty chart and see, and the premium contribution, to see who would benefit. Okay, because under this law, it's not all things to all people, and that's what's very frustrating about it. I think, for employers. And also there's a lot of miscommunication out there. I think people think that affordable means something different than it does. And when they go to the marketplace to get the subsidy, they may be surprised that they're actually not eligible for a subsidy after all.
You know, I would point out in my conversation with Ron, one of the advantages that was attractive to people in the cafeteria plan, that effectively, as I understand it, the employer is out of the insurance.
Correct. And then you're not tied to the healthcare inflation. You're not involved in COBRA. They can do, yes, they can do whatever they want. But now if you disband, and that's why the simple is great, because if you choose to disband, you probably don't want to just say go to the marketplace. It gives them something that they can use to help with that coverage. But yeah, you're out of the game. So. Yes, please.
Also on the simple, which becomes a nice additive feature, is currently if you're a small employer, and let's assume you have over 5 employees just for choice, and you're with Optima, because over 5, if you have a HSA, you're allowed to have 3 plans. When you go to a simple plan, you're now giving the employee the total choice of Anthem, Optima, Cigna, whoever is in that exchange. The employee may elect, because they never go to the doctor and because of cost, go to the bronze plan. The wife or the spouse may elect to go to the platinum plan with a totally different doctor or carrier, because her doctor has never been in the network that you currently offer. So you're able not only to wipe your hands of the insurance business, number 2, you're able to give your employees compensation for coverage, so you're not, for lack of better words, pulling the carpet out, but you're giving them the flexibility to make a choice of 4 different type of plans, and really 5, because if they're under 30, they can also pick a plan that's specifically designed for anyone under 30, but they now have a choice of carriers as well. And whoever does this simple type plan, and I know there's several people we've talked to about it, whether it be myself or John or Julie, whoever it is, we're going to be there with that employee. Because as we all sit here, and even Corbin and I or John, knowing how much we study, we're still deer in headlights sometimes. And for that employee, it's going to even be worse. So we're going to be there holding their hand, talking to them, and attempting to determine not which carrier they should use, because that most likely will be their choice, but at what level do they want to go to on this type of plan. And next year, when it comes to a renewal, you're not faced, like Tom said, with, to some extent, where do I want to go? What plan do I want to offer? It's pretty simple. I'm going to change my compensation to 3% rather than 2%. And again, that time and effort that you would have spent going through all these plans has now been removed. And your employee now has the onus on them to make what we call an educated decision.
Let me make one other comment.
Sure.
I really enjoyed the conversation we had in education. The other thing that I need from that conversation, I think I picked up, is that the employee under that type of plan is no longer penalized by the experience rating of a group plan of somebody else. Is that correct?
Correct.
That's the same.
Yeah.
Does anybody have any other questions? Yes.
For a small company with a small group, every group is unique. How do you recommend we go about, there's lots of options here, assessing for our particular group what is the least painful somebody's going to be winner or loser, it seems like, in all these. What's the least painful part to do?
Well, I would say the first thing that you would need to do would probably be look at, I know you don't know employees' household incomes, but if you could work with your broker somehow and they could get that information. And Rod, I should ask you, are you guys working to do something with that, to do that analysis?
Terry has set out on that, I don't even know if it's on the sheet that we're showing up here, the slides, but we have sent everyone what we call an employee analysis sheet. And in the past, and a lot of you have been in this for years, when we talk about health insurance, one of the items that never, ever was brought up is how much does your employee make? That was never the issue. We never had to ask that question. It was, you know, family, single, tier, whatever the case. Now, as you can see, the pain that we are experiencing, those forms have been sent out to everybody where we're asking people to list the employee's name, their date of birth, their salary, what tier they are, their employee and child, family. We know that you do not know that Bob, who makes $8 an hour, who's married to Susie, who's an executive vice president of Corning Glass, we don't know that. We can only estimate that. But we have been getting a lot of these forms back already completed, and Terry and I have started diligently going through and analyzing what is best. Now, a lot of people, we've also gotten a lot of rebuttal back because they don't want to give out salaries. And we can appreciate that. And that is it is confidential to us as it is to you. But as everybody that is listening in and seeing what is on these screens, now that employee's salary can determine what is the best rate for everybody. And we'll be one-on-one with every employer, every one of our accounts before January 1. We've already been doing it and trying to determine, and Randy, you're 100% correct in what he just said, everybody has a unique situation. In this law, there is absolutely no way to cookie cut a plan, a carrier, or any type of situation.
And I think that's a really important point, and that's why the education is so important, because if you understand the underlying issues, then you can help address how it is moving forward, because it isn't a conversation about deductibles and rates so much anymore, but what is someone's income. So, and with that, I'm going to actually go ahead and end it, and we've already kind of started with questions, but if anybody has an additional question. And Rod, you are monitoring the internet world there. Is there a question?
There's enough of them here that I'm going to address them later.
Okay. All right.
I don't want to shorten someone out by not answering their question.
Okay. Well, thank you very much for coming. And did you want to say some closing words?
Yes. This law can be very intimidating. One of the things that we're looking at, and Corbin did bring this up, is we're not looking at 2013-14 when we just talk to you about your plan designs. We're looking at 2014 and 2015. Because, granted, we do not know what's going to happen in 2015. But I'm a very, very avid sports enthusiast, and I think one of the great quotes that I've heard in sports, and it applies here as well, is from Wayne Gretzky, who's probably the greatest hockey player, if not of all time. And someone asked Wayne Gretzky, what's the difference between a good hockey player and a great hockey player? And he said, a good hockey player goes to the puck. A great hockey player anticipates where the puck's going to be and is prepared for the shot. And that's what we're trying to do here in this agency. We're worried about 2013 and 2014, but we're trying to get everybody prepared for 2014 and 15. And just by seeing what we've tried to condense here in an hour, hour and a half of slides, this has been our world for the last 5 months. And we all could get in the car and drive home today, and everything that Corbin has presented and put so much effort into these slides, we're hoping is going to stay in place. But we don't know that. But we want to make sure that you, as our clients, realize that we're there 100% of the time. Corbin is there for a phone call 100% of the time. Any way that we can assist you, we're going to be there. We're a team, and we're going to get through this together and make it good for everybody. Thank you. I guess it's off, yeah. Now we'll turn it. Make sure you turn it off. Yeah.